Welcome back. You're watching SA Today on SABC News with me, Flo Ledwaba. A new scholarship program to help community physicians across Africa to be certified in lifestyle medicine has been launched. Lifestyle medicine is evidence-based practice of incorporating plant-based food, physical activity, positive sleep and distress habits into a patient's life to proactively prevent, treat and reverse chronic diseases. The Infinite Food Scholarship for Lifestyle Medicine will be providing both financial support for interested physicians to study and complete the lifestyle medicine certification exam, as well as establish lifestyle medicine organizations. Joining us now is Jolene, Dawson, head of CSR and supply chain at Infinite Foods. Jolene, thanks very much for joining us here on SABC News, ma'am. Good to have you with us.
Thank you for having me.
As a start, let's talk about the program as a whole, but more so a sort of understanding, a real understanding of what this lifestyle medicine is. I think we kind of briefly spoke about it there in our intro, but perhaps in layman's term, if you could explain to us this lifestyle medicine, but also the program at large.
Sure. Lifestyle medicine, as you mentioned, is an evidence-based where medical practitioners will look at a patient not only to treat the symptoms that they currently are experiencing, but also to have a look at all of the aspects of their life. So are they sleeping effectively, and are they eating a sufficiently balanced diet? In lifestyle medicine, they purport to recommend a diet that is whole food, plant-based, and they also make sure that people are well connected with their society. Lifestyle medicine overall is a fairly unknown term at the moment, but it's meant to support lifestyle changes. If we look at Africa at large, one of the most pervasive causes of death is lifestyle diseases, things like high blood pressure, things like strokes, cancer, certain cancers, not all cancers, things like diabetes. If you think, many people say, my mom has diabetes. It's not just your mom, it's everybody's mom almost that has diabetes. In South Africa specifically, diabetes is the number one cause of death amongst women. Our scholarship is intended to expand the number of medical practitioners across Africa that are certified in lifestyle medicine so that they can treat patients not just from a pharmaceutical perspective, but can also help them lead healthy lifestyles.
Yeah, I really want to talk more on this lifestyle medicine. This is quite an issue close to my heart too. But in terms of, you talk about taking all aspects of a patient's life, and I'm just interested. A lot of us will go to, our GP, the GP we've had most of our lives. Are GPs also sort of incorporating this into how they treat patients? Is it just, GPs will generally just give you some kind of medicine to fix something, but are they really looking holistically now in terms of looking at this lifestyle medicine?
From what I understand, currently all of our qualified doctors in South Africa spend less than 1 month looking at holistic treatments for patients. So they're taught to follow a diagnosis based on symptoms that are presented with the particular patient in front of them at the time. What lifestyle medicine does, which is different, is it has a look at all of the different aspects. So, for instance, are you eating the balanced diet? Are you incorporating sufficient vegetables and fruits and whole grains into your diet? One of the key aspects, are you getting great quality sleep? Because that's a massive impact on what can happen to you from just an overall health perspective. Are you having sufficient time to de-stress after your working day? Do you have sufficient support from a social perspective? Yeah. So I really do think that our doctors are not sufficiently trained to look at patients on that holistic level. Yeah. This lifestyle medicine certification is intended specifically to help doctors understand how to address those broader aspects of life.
But is this becoming a little bit more popular? And I'm just wondering where else in the world this is starting to become, a better way of treating patients. Obviously, you're saying that a lot of our doctors here aren't necessarily using it, but I imagine that elsewhere, it has shown that it works, and I'm just wondering where in the world it has become quite popular.
The lifestyle medicine certification is governed by the Lifestyle Medicine Global Alliance, which is a US-based organization.
Yeah.
In Africa, specifically, there are 2 associations which support communities of doctors that are certified in lifestyle medicine. The one is in Nigeria, and the other is here in South Africa. And us as Infinite Foods, we helped incorporate and set up the South African Lifestyle Medicine Association last year.
Yeah.
So yes, it is becoming more pervasive. And if you look at the increase in plant-based diets globally and the impact that that can have on your overall life, it has been significant over the last decade or so.
And just as we wrap up our conversation, please, Jolene, if you can talk to us about, those physicians who are, interested in the program, and maybe there's some who'd like to perhaps access the scholarship. Where exactly do they start?
So we've made it very simple for medical practitioners to actually apply for the scholarship. You simply need to go to our website, which is www.infinitefoods.com, and you will find a banner on the homepage. You can click on the banner, or you can navigate to our story and you can click through to the application there. In our scholarship, we're prioritizing youth and women because we believe that they're a group that is typically overlooked for scholarships, so we're prioritizing those. But it's a very simple application process and shouldn't take more than 15 years.
All right. Jolene, thanks very much for being with us this afternoon here on SABC News. Thank you.
Thank you for having us.
You're most welcome. That's Jolene Dawson, head of the CSR, and giving us more information on lifestyle medicine, and very clear on how this whole thing helps holistically if we are to look into it.